Right. Begin. You can read. Okay, so if you have read and understood, considering it critical care scenario, kindly tell me how would you manage this patient?
I will manage this patient using following the care of critical ill patients using
Yes.
CRIS protocol.
Yes.
After history and examination of this patient, I
Okay.
want to cite a white blood cell. So you start with give IV fluid, crystalloid. Want to give analgesics, give pain relief, and I want to do some investigations to water to
Yes,
cause.
please. Which investigations would you ask for?
The abdominal ultrasound, abdominal CT scan.
If you can read the question, it already shows there are raised certain blood tests. What
Liver
does it
function
show?
test.
Yes, what does it show? What?
The
How would you read that?
alanine transaminase, aspartic transaminase are elevated, and alkaline phosphatase and GGT are elevated. Then also urobilinogen is said to be absent in the urine, which
Yes.
is
What does this signify?
This is in keeping with obstructive jaundice. It means the conjugated bilirubin does not get to the colon.
Patient has had 4 episodes of diarrhea. How would you take care of that? This 4 episodes of diarrhea can result in loss of which important minerals and ions?
The patient had the episode just to want to give patient IV fluids to replace the ongoing loss.
Which type of IV fluid would you suggest in this particular situation?
Crystalloid, preferably.
Okay. How would you determine how much fluid is needed? Yes. How would you determine? Yes. How would you determine how much fluid is required for this particular patient?
The daily maintenance with ongoing loss is what will be given to the patient.
Okay, can you please tell me, right, because of these LFTs, liver function tests are deranged, one can say. What are the clotting factors which will be also deranged because of that?
Yes, the clotting factor 2, 7,
yes.
9, and
Yes.
2, 7, 9, and 10 will be deranged because the bile acid is not being absorbed, and this will affect vitamin K, which is a fat soluble vitamin.
Vitamin K, yes.
So this will not be absorbed. And so 2, 7, 9, and 10 are vitamin K dependent clotting factors.
What is the function of this ALP, alkaline phosphatase, which is raised in this particular patient's lab test? Or what does it signify?
Alkaline phosphatase is an enzyme found in the epithelium of the biliary canaliculi.
Yes.
So in the absence of in terms of cholestasis, usually being elevated.
Okay.
Yes.
Can you
However,
tell me?
It's not specific to the back. It can also be found in some other areas like the center and the nose.
Okay. Can you please tell me what is the normal bilirubin level in a human being?
it should not be greater than 34 micromole per liter.
Okay. Can you please tell me how this bilirubin metabolism takes place?
The bilirubin is carried in the blood by following the breakdown of red blood cells. The hemoglobin is broken down into heme and globin. The globin goes into the protein pool. The heme is converted to biliverdin, then biliverdin to bilirubin. Bilirubin is carried in the blood by the albumin to the liver, and the liver and dropped the bilirubin into the hepatocytes. Then within the liver, the bilirubin is conjugated by bilirubin via glucuronic acid via glucuronide to form conjugated bilirubin. This is excreted into the bile stored in the gallbladder. Following the ingestion of food, this is released, and a CCK acts on the gallbladder and release the bile that goes towards the second part of the duodenum over the.
Okay, can you please tell me what is tarcobilin?
This goes down through the small bowel.
Can you tell me what is tarcobilin?
Tarcobilinogen is a byproduct of the bilirubin metabolism that is formed by the action of bacteria within the colon.
Okay.
Bilirubin to form this tarcobilinogen. Tarcobilinogen when is.
Can you please tell me what are the functions of the bile salts when it comes to digestion of fat?
It helps to emulsify the fat, forming the micelles. It has two ends, the hydrophilic and hydrophobic end. The hydrophilic end is what's used to communicate with the outside. The hydrophobic end is what communicates with the fat. There's this area of it that form together from the micelles in the surface area of.
Okay, can you please tell me what would you do next to manage this patient, because your management was not complete? You only told about giving the resuscitation fluid and then taking the blood test, and then?
We take the blood test, which includes these have been taken together with clotting profile. We also want to do investigation, radiological investigation like abdominal ultrasound.
Yes.
And abdominal CT scan, and this could tell if it's the cause of the obstructive jaundice, if it is
okay, can you please tell me
if the pancreas, if it's gallstones, the gallstones, and it is
can you please tell me what are the causes of the jaundice?
Causes of jaundice could be pre-hepatic, hepatic, or post-hepatic jaundice. The pre-hepatic usually caused by hemolysis or sepsis, and the excess breakdown of the red blood cells.
Yes.
It could be congenital or acquired. The hepatic jaundice is
considering
any pathology of the liver.
This patient's lab results that you can see, which one of the one would be responsible for this patient's jaundice? Would it be pre-hepatic, hepatic, or post-hepatic? Okay. What are the examples or the causes of post-hepatic obstruction or post-hepatic jaundice, other than gallstones?
Yes, sir. Polydocholithiasis.
Yes. There could be.
CA pancreas.
Yes, good.
Pancreas,
good.
Cholangiocarcinoma.
Yes.
Periampullary CA.
Yes, very good. Okay, good. Yes, time has ended as well. Very good. Okay. Right. So